Hello, family. Midwife Key here, and you're welcome to yet another episode on my channel. Now, in honor of Pink October, which is Breast Cancer Awareness Month, our topic for today is going to be breast cancer, which is the most common cancer in women globally and a leading cause of death. Cancer is the growth of abnormal tissues in the body. They require nutrients and blood to grow and multiply, which destroys other tissues and causes malfunction. This abnormal cell growth is called a tumor, which can be malignant, which is cancerous, or benign, which is non-cancerous. The breast is the mammary gland on the chest of humans and other primates. So when we talk about breast cancer, it is a disease in which abnormal cells in the breast grow and multiply to form tumors. It is one of the most common cancers worldwide, which can happen in women, men, and transgender individuals. The signs and symptoms of breast cancer are lump in the breast or the underarm, thickening or swelling of parts of the breast, dimpling of the breast skin, redness or flaky skin in the nipple area or the breast, inverted nipple, pain in the breast or the nipple discharge other than breast milk, including blood, and then any other changes in the size or shape of the breast. Now you may ask, how does this happen? When it comes to cancer, we do not know what exact causes of cancer is. But what we do know are some factors that can put you at risk of getting the disease condition. Some of these unchangeable risk factors are gender, because women are significantly more likely to develop breast cancer than men. The risk of breast cancer increases with age. Majority of breast cancer cases are diagnosed in women over 50 years. About 5 to 10% of breast cancer cases are hereditary, caused by inherited gene mutations. Family history, where the risk is higher if a person has a first-degree relative, which is a mother or sister, with breast cancer or ovarian cancer. Dense breast tissue, in which there's more connective tissue than fatty tissue, which can increase breast cancer risk and make tumors harder to detect on a mammogram. Exposure to the drug dithylstilbestrol, which was given to women in the US between 1940 to 1971 to prevent miscarriages. But women who took it have a higher risk of getting breast cancer. And then women whose mothers took it whilst pregnant with them also have a higher risk. Women with personal history of breast cancer are also at risk of developing a new cancer in the other breast or in a different part of the same breast. Reproductive history, like early menstruation, which is starting your period before age 12, increases your lifetime exposure to hormones like estrogen, which can fuel the growth of breast cancer. Entering menopause after age 55 means longer hormone exposure, which also increases your risk. Having a full-term pregnancy after age 30 or never having a full-term pregnancy is associated with high breast cancer risk. Radiation therapy to the chest before age 30 also increases the risk of breast cancer later in life. And then some changeable or modifying risk factors like alcohol intake increases the risk of breast cancer. Weight and obesity, especially after menopause, increases breast cancer risk. A sedentary lifestyle with little to no physical activity is linked to higher risk of breast cancer. Hormone replacement therapy, which is the use of estrogen and progesterone after menopause for more than 5 years, increases breast cancer risk. Smoking can increase your risk, particularly in younger and premenopausal women. And not breastfeeding, which is linked to a higher risk of breast cancer because breastfeeding lowers lifetime exposure to estrogen, suppresses ovulation, and facilitates the removal of cells that may be at risk of becoming cancerous. Now, did you know that there are stages to breast cancer? There's stage 0, which has a 100% survival rate. Stage 1, that has a 98% survival rate. Stage 2 has an 88% survival rate. Stage 3 has a 52% survival rate. And then stage 4, whereby the cancer has spread beyond the breast to other nearby areas of the body, has a 16% survival rate. So we do say that prevention is better than cure, which is indeed true, because in this case scenario, cancer really does not have a cure. So it is very important to avoid smoking, limit your alcohol intake, control your weight, and maintain a healthy lifestyle by focusing on a diet rich in vegetables and fruit. Reduce exposure to radiation, engage in regular physical activities. If you are on hormone replacement therapy or birth control pills, discuss the associated risk with your doctor to see if it's right for you. Consider breastfeeding, which can play a role in reducing breast cancer risk. Having regular screening, which is having your breast examined regularly by a health professional, or you can do a self-breast examination every month after your period to check for lumps or changes in your breast. Regular mammograms can also be done, which is crucial for early detection, which significantly improves survival rates. In case any sign or symptom is detected, the definitive way to confirm cancer diagnosis is through biopsy, which is the removal of sample tissue to examine for cancer cells. Early detection through breast screening and awareness of symptoms is very crucial for better outcomes and to save a life. Now, for persons that are diagnosed with breast cancer, treatment through surgery like lumpectomy, which is the removal of the lump or tumor and a small amount of healthy surrounding tissue, and mastectomy, which is the removal of the entire breast, which can be reconstructed. There's also chemotherapy, and this is when powerful drugs are given to destroy fast-growing cancer cells, and radiotherapy, which is when a machine uses high-energy beams to kill cancer cells or shrink tumors. Now, for persons that have the disease condition and or are going through treatment, they can experience energy loss and fatigue, cognitive impairment related to forgetfulness and fuzzy thinking, mood changes or depression, hair loss due to chemotherapy, skin irritation and dryness due to radiation therapy, metastasis, which is the cancer traveling to your major organs like your heart, lungs, and causing malfunction. Gastrointestinal system troubles, which happens because chemotherapy and radiation therapy can inflame the intestine and digestive tract. Sexual health dysfunction, swelling and pain in the limbs and the joints. Now, cancer is no joke. To have breast cancer is no joke. For affected persons, we sympathize with you. We stand with you in togetherness, and we fight with you. It is very important to get a regular breast screening by a health professional, or you can also even do a self-breast exam at home to notify any changes in your breast, because early detection is crucial for the best outcomes and then increases your chances of survival. Thank you very much for staying with me throughout this episode. I'm sure that by now you know a lot more about breast cancer, its signs and symptoms, its risk factors, effects that it can cause on your health, and treatments that can be done if it is detected. Because you know that sharing this piece of information can save somebody's life, please do not forget to share this video, like, comment, and subscribe to my channel for more information. Thank you for joining Midwife Key today. Until next time, it's bye-bye.